Welcome to University Hospital Southampton. During what may feel like a worrying and challenging time for you and your family, we hope that this short video will give you an insight into the journey you will experience as you undergo your operation. Prior to the day of surgery, you will be asked to come into a ward where you will be welcomed by the nursing staff and reviewed by one of the anaesthetic doctors before your procedure.
You'll be seen by an anaesthetist before your operation. We'll chat to you about your general medical health and in particular any heart-related or breathing conditions that you might have. If it's okay with you, I thought what we could do is have a little chat about your health to start off with, just do a bit of a history review, go through some of your medications and so on, and then there'll be an opportunity to talk through the anaesthesia as a procedure and everything that it entails. Hopefully be a good opportunity for you to talk through any experiences you've had before, or if there's anything you're concerned or worried about. On the day of surgery, you may be given some medication on the ward to help you feel more comfortable and relaxed. You'll then be wheeled around to theatres, where you'll be met by the anaesthetic team, who will carry out the necessary checks and attach routine monitoring. We will insert a drip to allow us to give you medication, and another line into your wrist to monitor your blood pressure. We numb these areas before we do this, to make sure you're as comfortable as we can. Following this, we will give you medication via your drip and some oxygen with a mask and drift you off to sleep. The anaesthetic team will be present throughout the procedure to ensure you remain safe and asleep. Once you are asleep, a tube will be inserted through your voice box to support your breathing, and another line will be placed on the side of your neck. We may also use an ultrasound scanner which is inserted into your food pipe or esophagus to allow us to view your heart and aid the surgeons. As with any procedure, there are specific risks that we'll discuss with you. There are risks of general anaesthesia relevant to any patient having an operation, that of potential post-op nausea and vomiting, a sore throat, or the degree of pain that might be expected. In addition, there are some specific risks. The invasive lines cited, including the arterial line and the central line, it's possible to cause bruising, bleeding and infection, but these risks are extremely low. There are also some rare risks associated with anaesthesia for heart surgery. It is possible to damage teeth. It is also possible to damage nerves, and these risks are incredibly rare and quoted at less than 1%. If you are undergoing valve surgery, it's likely you will be given a transesophageal echo or TOE, and there is a risk associated with this of 1 in 1,300 of damage to the esophagus. This is incredibly rare and much more likely people complain of a slightly sore swallow or throat. You might also need to receive a blood transfusion during your operation, so please let us know if you have any worries about this. Due to the medication you receive and the surgery itself, you might wake up feeling confused and disoriented, which tends to resolve over a few days. The anaesthetic team uses a variety of medicines and techniques to ensure that you're kept as safe and comfortable as possible throughout your operation.
After your operation, you will be taken down to either the cardiac intensive care unit or the high dependency unit. At this stage, you'll still be asleep. You'll be receiving medication to keep you very comfortable, and once the team feel that it is safe to do so, you'll be woken up and the breathing tube will be removed. We'll carry on giving you medication to help keep you comfortable, painkillers and anti-sickness medicines. These will ensure that you're able to take some deep breaths and to move around the bed when it's safe for you to do so. Getting out of the bed with assistance will help you to recover more quickly and will prevent complications. On intensive care, you'll meet our excellent team of nurses, physiotherapists and doctors who will help you on your journey. As a team, we're here to support and answer any questions that you or your family may have about your care here. On the day of your surgery, your next of kin is welcome to contact the intensive care unit and we'll be able to give them an update on how your procedure has gone. The majority of our patients stay here on the intensive care unit for at least a day or two, and then several days more on a cardiac ward afterwards.
Hello, my name is Annie and I'm a physiotherapist on cardiac intensive care. Prior to your heart surgery, you will be sent information including mindful movements whilst your breastbone is healing for up to 12 weeks. This is called Keep the Move in the Tube. Following the surgery, we will remind you of the mindful movement and explain what you should and shouldn't do day to day initially. Evidence shows it is safe and beneficial to get moving after surgery, to move secretions from your lungs and re-expand them, to boost your circulation, and to avoid deconditioning or getting weaker. Your breastbone will be surgically stabilised and your pain will be controlled with medications to allow you to practice deep breathing and coughing out secretions after the operation. It is important to do this regularly for the first few days during your recovery to keep your lungs clear and reduce the risk of a chest infection. You are likely to have drips and drains attached after the operation. We have an experienced team of staff who will help you to get moving after your surgery, despite the attachments. From day one, we will start to get you moving in bed, and you may sit out in a chair for your meals. Your rehabilitation will be tailored to you and your mobility level. Exercises will be provided, and your mobility progress to walk on the intensive care unit if that is appropriate for you. Our specialist therapy team will guide you through your initial recovery from heart surgery, follow your goals, and continue to work with you on the wards until discharge from University Hospital Southampton.
We hope that this video has provided you with an insight into the journey you will experience, and we look forward to welcoming you to University Hospital Southampton.